You know, I want to raise an issue. It was raised in the Finance Committee markup. It was raised in the healthcare markup. I have behind me the Medicare cuts, and I understand they've been slightly reduced, I think, to home health in the Reid bill. But we are going to cut Medicare. We're not going to cut it significantly in the fraud, $2 billion. That's where the real waste is. But when offered an opportunity, the senator from Rhode Island, who came down here and said we were trying to scare people, and when offered the opportunity, the chairman of the committee, to prohibit rationing of health care in this country, they both voted against it. Just a simple, straightforward saying, no matter what we do in health care, we're not going to do what other countries have done and ration health care. Straight up and down votes, party line votes against it. That in fact, we're going to ration health care. That's what this bill does. The way we're going to control costs is through the mechanisms outlined in this bill that are going to allow government bureaucrats to decide what you can get treated for, when you can get treated for it, and where you can get treated for it. And the rebuttal of that is Medicare, it's already illegal for them to ration care. So we don't need a prohibition. Well, the fact is Medicare is rationing right now. They're rationing virtual colonoscopy. They're rationing bone densitometry. They're rationing Epigen. They're rationing Neupogen, two key drugs to maintain survival during the treatment with chemotherapy. They're practicing medicine. So when given the opportunity to vote and put an absolute prohibition on the rationing of health care, what did the chairman of the Finance Committee do? He voted against that. Because what he recognizes is the ultimate plan. And the answer to Senator Byrd's question is this will collapse. It's not going to be sustainable. The Medicare cuts won't be made by us. We'll put it off on a commission and says, oh, we had to do it. And the result of that will be rationing. And the other result will be what the senator from Vermont actually wants, which is a single-payer, government-run system. That's why he's intellectually honest. He brought it to the floor and said, this is how I think we ought to solve health care. We ought to have the government run it. We ought to have the government make the decisions. And he was honest about it. That's where this bill's going. So if you're a Medicare patient, you should be concerned. If you're a Medicare Advantage patient, you should be concerned. I've had criticism leveled at me because I do what the chairman of the Finance Committee, I make competitive bidding for Medicare Advantage. There's a big difference. Mine's with no cuts in benefits. They cut benefits 50% in terms of the Medicare Advantage differential. There's three things you can do to fix health care in this country.